everyone. My name is Ariel Harrison. I am here today to talk to you about the development and publishing of the Texas Viral Hepatitis Elimination Plan. Um, and so, just a quick note, I don't have anything to disclose, so there's no conflict of interest. And then so I have to let this slide be here. So, the use of trade brand names, the views expressed do not necessarily reflect the official policies of Department of Health and Human Services, um, as you can see on the slide. Okay, so a few notes about me. I am a health services researcher, but I'm currently a community relations associate at Baylor College of Medicine. I recently just completed my PhD in health economics and health services research at the University of Texas Health Science Center, School of Public Health here in Houston. Um, this past May of 2026. I have over 10 years of public health experience, and my research interests are here at the bottom, as you can see: health equity, health disparities, social determinants of health, along with policy, which we'll talk about a little bit today. And so, the learning objectives for today, we will define viral hepatitis, its symptoms, causes, and other important facts. I also define the project that I'm on currently, called the Texas Collaborative Center for Hepatocellular Cancer or Liver Cancer, and describe our connection with the Texas Viral Hepatitis Elimination Plan. Um, I will also describe the process for developing that plan with the Texas Department of State Health Services, or like I call them, DISHISH. And then I will also outline the contents of some of the contents of the Texas Viral Hepatitis Elimination Plan and the role of the coalition. So first, I'm going to actually get out of my um, slideshow because I wanted to do an interactive question. So give me 1 second because it won't play on the slideshow, as you can see. But let me exit out of it and get back into it real quick. Give me 1 second because I want this. I want the question to show. Um, can you all still see my screen?
Uh, yes, we can see the PowerPoint.
Okay, good, good, good. Um, okay, let's see. I know it's going to be small, but just bear with me for a second because I really just want to let the question pop up on the screen. Um, and I will say the rest of that. But if you could use menti.com to answer this question and use the code to reply. But the question reads: when you hear the phrase viral hepatitis, what are the first three words, symptoms, or facts that come to mind? I'll repeat it again. The question is: when you hear the phrase viral hepatitis, what are the first three words, symptoms, or facts that come to mind? And I hope it populates onto the screen. Maybe. Let's see the two. Okay. Oh, yay. Cool, cool, cool. Everybody can still see the screen, right? You see the words on the screen. Yay. Okay. Treatment available: infections, Hep B, HIV. Okay. Fibrosis. Good, good, good. Hep C. IV drug use, liver enzymes, blood to blood. All right. The IVDU. Not sure what that is. Hep A. Okay. Okay. I'll give a few more people time to jaundice. Okay. Good, good. HCC. Yes. 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 Very good. Um, I don't know if people are still replying. Um, Treatment available. Yes, these are all good. Very, very good. Okay, well, I'm assuming that's everyone. Okay, I still see some some invisible. Okay. HPV, yes. Okay, if I wrote said that. Okay, good. Thank you for participating to those who participated. These are all very good words and symptoms and facts when you think about the phrase viral hepatitis. Okay, so I'm gonna go back into presentation mode and we'll go from there. Okay. So I wanted to provide some quick facts about viral hepatitis. Viral hepatitis is the inflammation of the liver caused by one of five primary viruses, A, B, C, D, and E. Can cause severe liver damage, liver cancer, or liver failure. Some common symptoms, as some people put into the Minty, jaundice, which is the yellowing of the skin and the whites of the eyes, fatigue and muscle joint pain, dark urine and pale clay colored stools, nausea, vomiting, and loss of appetite, fever, and upper right abdominal discomfort. Some facts: there are over 300 million people in the world that live with viral hepatitis. Hep B and C are transmitted through blood. Another part of um, the facts about viral hepatitis. Um, there are over 1.5 million people dying each year from viral hepatitis as well. But like I said, hepatitis B and C are transmitted through blood. Hep B is usually spread through unprotected sex or sharing of the needles, and Hep C is spread through contact with infected blood and frequently becomes a chronic condition. And another quick note about Hep B and C: Hep B can be treated, and Hep C can be cured. Um, People with viral hepatitis can be at increased risk of liver cancer, and then ultimately, prevention of hepatitis remains central in eliminating viral hepatitis, which we'll talk about the elimination plan in Texas today. So, how did we arrive here? I will provide a tech overview in relation to the Texas Viral Hepatitis Elimination Plan, along with the coalition. So, the Texas Collaborative Center for Hepatocellular Cancer, TEC, as we like to call it, the goal of TEC is to reduce HCC or liver cancer mortality in Texas by reducing the number of people who develop cancer or detecting it early when it is curable. So we do that by support and enhance research collaborations. And we educate providers and researchers along with the public on liver cancer and the current research that's happening with liver cancer. We engage stakeholders and solicit strategies to improve HCC prevention and care. And then we engage private and public entities in policy considerations. I also want to make note that TEC is funded by CPRIT, which is the Cancer Prevention and Research Institute of Texas. And so this is the organizational structure of TEC. As you can see, with oversight, evaluation, and coordination, we have the steering committee, which we meet quarterly to talk about what's currently going on between the committees and cores, and of course, facilitate communication and interaction across committees and certain research projects. And then we have the administrative core, which is technically just uh, myself and Dr. Elsarag. I also want to mention Dr. Elsarag. He's the chair of the Department of Medicine at Baylor College of Medicine. He leads this project as well. So I work with him as the administrative core on the administrative core, and then the external advisory committee just helps develop strategic plans for TEC. And then for research support and synergy, we have the Population Research Corps. They provide data support to investigators with HCC prevention and biomarker projects. And then the Discovery Science Group performs multiomics assays. And then the pilot project program is a platform to enable Texas-based investigators to collaborate on liver disease projects. And then lastly, the dissemination and implementation section. We have the Implementation and Outreach Committee, which serves as a platform for educational materials to get out to the public. And then um, the Health Policy Core, which I will talk about a little bit more throughout the presentation, um, has worked with the Texas Department of State Health Services on the Viral Hepatitis Elimination Plan and provides policy guidance on liver disease in Texas. And then lastly, the annual symposium committee, who leads the efforts of planning the annual symposium. And so, like I said, this is the organizational structure of tech, but today we'll just be focusing mainly on the health policy core and give a little bit more information on the viral hepatitis elimination plan. So in 2022, we held a multi-stakeholder conference. It was co-sponsored by Rice University Baker Institute. We invited HCC researchers, policymakers, payers, members from pharmaceutical industry, and patient advocacy groups in and outside of Texas. The goal of this meeting was to identify different strategies for preventing HCC and evaluate their readiness for implementation. It ultimately resulted in connecting with DSHS, or the Texas Department of State Health Services, and calling for a statewide viral hepatitis elimination plan. And I also want to give a little bit more context about HCV elimination. Around the time of the multi-stakeholder conference, there was a new nationwide elimination plan for HCV with the goal of reducing the incidence of new infections. Upon starting this journey with DSHS, we found that Texas did not have a statewide elimination plan for Hep B and Hep C, and so we collaborated with DSHS to start this effort. And so, in connecting with DSHS, we first did a summit. And so, we hosted a summit in May of 2023, where we invited health and social service providers, community grassroots organizations, those who are affected by HCV, city and county health jurisdictions to formulate a consensus statement that will lead to the development of the elimination plan. We had about 50 guests or 50 participants who came, and these are some of the organizations that were present at the summit. And so from the summit, we had the summit in, as you can see the timeline, we had the summit in 2023. And then around August and September of 2023, we can confirm the writing committee chairs. And I'll go into the sections that were represented as the writing committees. And then in November and December, we had the development of the elimination plan with the strategies, implementation, and metrics. And then we drafted the plan in January 2024. We routed it to DSHS for approval in June 2024. And then the plan was released in October, this past October of 2025. So as you can see, it took pretty good time, pretty lengthy time, and a lot of effort to ultimately publish this plan. And so the Texas Viral Hepatitis Elimination Plan, like I said, was released in October 2025 by DSHS. The goals outlined in this plan seek to guide program development and resource planning, support consistent messaging and education, promote integrated service delivery, and foster long-term partnerships across sectors. These are the 4 foci, the places that we focus our efforts on within the plan. As you can see, prevention, treatments, data and surveillance, and along with policy. And so these represented our writing committees. We had, of course, the prevention writing committee, treatment writing committee, and so on and so forth. And so we drafted the plan to look like this, as you can see. For prevention and awareness, here are the goals for this section. Goal 1 is to empower and educate Texans about viral hepatitis transmission, testing and linkage to treatment. Goal 2 is to increase the proportion of people who know their HBV and HCV statuses. Goal 3, prioritize harm reduction education and best practices. And then goal 4, to improve hepatitis A and B vaccination efforts. For care and treatment, the goal 1 is to improve access to patient-centered HCV treatment services for Texans, and then goal 2 is to expand the number of hepatitis treatment providers in Texas. And then for data and surveillance, goal 1, continuously monitor the state of the viral hepatitis surveillance system to improve the quality and completeness of hepatitis data. And then policy and community mobilization. Goal 1 is to increase viral hepatitis prevention, testing, and treatment services through the support of policy development and community mobilization. So the role of the coalition, essentially, they are pushing for these goals and these tasks to be complete. Um, and so this just has established a statewide listserv to provide timely communication, resource sharing, and engagement opportunities for partners statewide. And so I wanted to list some of the tasks for each of the prevention, care, data, and policy sections, or the focuses in the plan. And so as you can see for prevention, their plan is to, provide a template for planning guides. And then for care and treatment, the coalition and stakeholders will expand partnerships with pharmacy associations and pharmacy schools. For data and surveillance, DISHES and the coalition will use data-driven analysis and modeling strategies to assess the clinical impact of viral hepatitis. And then for policy and community mobilization, the coalition and stakeholders will support communities in developing local hepatitis elimination coalitions. And so there are more tasks, of course, with each section, and you can find you could find the elimination plan here at this website, and I could drop it in the chat if anybody wants to see it. But just wanted to talk about the role of the coalition. They're currently, the steering committee is going to meet at the end of July, and so we're trying to keep the momentum, and push forward with getting these tasks started within the plan. And so, in conclusion, the Texas Department of State Health Services, TEC, and our partners have worked tirelessly to develop this plan over the last few years. The release of the plan is only the beginning. We need individual and organizational action to ultimately eliminate viral hepatitis in the state of Texas. And then lastly, legislative action and funding are both needed towards bridging the gap of certain aspects within the plan that need to be addressed. And here is my LinkedIn. Here's my Gmail. And if you have any questions and comments, I welcome them. Thank you for your time.